We are going to perform mat activities. They are designed to improve progressively the patient's independence. Starting from supine lying to side lying, affected side of the patient is right side. For the neck, head and neck, flexion with rotation. For arm, flexion with adduction pattern. Patient grasps the top of the mat and pulls. For leg, patient flexes his hip and knee and places his foot on the mat, lateral to midline and thrust. Now from side lying to prone lying. For scapular pattern, depression and abduction. For pelvic pattern, flexion with rotation. Now from prone lying to gripping. The patient rolls into prone lying and therapist stands straight, his thorax facing towards his head, raising the patient on his elbow and lift his shoulder off the mat. Now from gripping to crawling. The therapist stands straight her at hip level facing the patient's head. Therapist grasps the pelvis and raises the pelvis well clear of the mat and therapist extends the elbow. Now from crawling to kneeling. Patient places his one hand at a time on the therapist's shoulder, then raises himself into kneeling position. Now from kneeling to kneel sitting. The therapist grasping the patient at iliac crest and rotate his pelvis towards herself. Now from kneel sitting to sitting on chair or bed. Patient puts her near hand on chair and raises the same side knee and places the foot on the floor, and therapist assists the patient into the sitting position with patient thrust her raised leg and rotate pelvis towards chair. Now from sitting to standing. The patient has to take support of wall bar or therapist himself to get up. Therapist grasps the patient at waist bend. This is all about the mat activities. Thank you.